welcome back to Med Topics Made Easy. Today's topic is going to be adult bradycardia. It's a pretty simple algorithm, but it's definitely going to be tested and, it shows up a lot in real life. So let's get started. So bradycardia means slow heart rate. Okay, we're talking about slow, and maybe next video we'll discuss fast heart rates. So what is considered bradycardia? If the heart rate is less than 50 beats per minute, that is brady. Okay, so first thing we're going to do, there's really only 3 steps in this whole algorithm. Step 1 is to try and identify and treat the cause, right? Usually we can figure out what is causing their bradycardia, right? So how do we make an algorithm for ourselves to realize? Because there could be a million differentials, right? So go in the A, B, C, D, E. A is airway, right? So check if they have a patent airway. Listen for breath sounds, just check in their mouths. If they are choking on something, make sure they have patent airway, because if they're not getting oxygen through their airway, then obviously their heart is not getting enough oxygen, and that's why it's beating slow. B is for breathing, right? Maybe they have a patent airway, but maybe they have pneumonia or COPD and they're not getting enough oxygen, and now their heart is really slowed down. So for that, easy treatment obviously is O2. Just put them on oxygen. Also for the airway, you might have to set up a different airway management. Maybe you'll have to intubate, or maybe there's some other airway management you have to take care of. So that's right away you identified and treated some causes of bradycardia. C is for circulation. You guys should already know all this. We discussed it in the earlier videos. So circulation, check their BP, right? If they have a low BP, maybe they're dehydrated, they don't have enough blood going through them, their heart rate is obviously going to be low. So you set up IV access, because also we're going to have to administer drugs possibly later. So you definitely need to start fluids going. And then D is for drugs. So maybe they OD'd on something. So this could be like their normal medications, right? So it could be like a beta blocker or a calcium channel blocker. Those slow down the heart, right? So if someone took too much of their beta blocker, they're going to end up with bradycardia. So for that, it's really helpful to know. Let's say if they're still talking, they could tell you, oh yeah, I took too much of my beta blocker. We know what to give for that, right? You could give glucagon, as we discussed in other videos, or calcium chloride for the calcium channel blocker. So that's for drugs. And then E is just to get EKG. Just put them on a monitor, because, let's say they're having a STEMI, and that's what's causing them, right? A heart attack is causing their heart to not function well enough. So it's obviously the rate is going to be going down, and that we have, the whole algorithm to deal with heart attacks. So that's first and foremost. Identify and treat the cause of this. Let's say you don't know the cause, or even if you thought you knew the cause, but now you're still having persistent bradycardia. So you're trying to treat it, but it's not helping because they're still being bradycardic. Plus, they're showing any of these. So either they have hypotension, which is a BP less than 90. So I don't care if it's 88 over 40, that is hypotension. Or they have altered mental status, so they're confused, they don't know what's going on, where they are. They're showing signs of shock, right? Let's say they have cool, clammy skin, or low urinary output, or maybe they're in the hospital, so you already have, BUN and creatinine, and those are going up. So signs of end organ damage. If they're having chest pain and you, let's say, don't have a STEMI, but they're still having chest pain, you're showing signs of heart failure. Maybe they have swollen legs, or, their lungs sound wet. That plus this, right? Still brady plus any of these, you have to treat this. Okay, you're going to treat this, either with electricity or medication, but this has to be treated. If they're persistent, but they don't have any of these and they're totally with it and their BP is good and they're stable, then you just monitor and observe them. You might, call a cardiologist to try to figure it out, but you don't have to technically do anything. So what is the last step of what we're going to actually do? So the hint is APED, which the mnemonic is all PAs eat dessert. Okay, so A is number 1. What is the one drug? It's an anticholinergic. So remember, cholinergic means we're slowing everything down. So if it's anti-slowing everything down, that means it's going to go up. So atropine is the anticholinergic drug we give. We give it IV bolus. We could give max 3 milligrams. So basically you could give up to 3 doses of this, because the dose is 1 milligram. So you could give one, wait 3 to 5 minutes, give another one, wait 3 to 5 minutes, and give another one. If that doesn't work, then we're going on to P. P stands for pacing. Okay, we'll just write this down. Pacing. This is transcutaneous pacing, where you basically put 2 pads on, you attach it to a defibrillator, and you basically you're not synchronizing cardiover. That's not for bradycardia. Here we're actually pacing with something called milliamps. You start raising the milliamps until you get capture on the machine, and we're trying to get it to, let's say, a heart rate of 80, which is a good heart rate to have. And this could be uncomfortable, so we might give them 5 milligrams of Valium to calm them down. Now, you could do also these, or you could do epi or dopamine. So either one, it's going to be an infusion that you're setting up. So the epinephrine infusion is 2 to 10 mics per minute, or the dopamine infusion is 5 to 20 mics per kg per minute. Important to remember the difference in dosing. And you're going to set up an infusion and you're just going to titrate and see if the patient responds. And if all these don't work and it's still going on, then you're obviously going to call in an expert. And you might have to do transvenous pacing, going through the venous system and setting up pacing that way. So it's a little more invasive, but it's more effective. So that's it for bradycardia. Very simple, guys.